Hey, hello everybody, and welcome to the Hennepin-University Partnership webinar series. Today's webinar is titled Current Attacks on Public Data, the Implications for Health Locally and Globally, and is presented by Dr. Elizabeth Boyle. My name is Margaret Stumbo-Turvey, and I am a Senior Project Manager with the Hennepin-University Partnership. The Hennepin-University Partnership is a collaboration between Minnesota's most populous county and its only land-grant university. At HUP, we are dedicated to catalyzing and supporting mutually beneficial relationships. The partnership has led to nearly 500 joint projects combining academic research and local expertise to inform policy and practice for the benefit of county residents. The goals of this webinar series are to offer information exchange and showcase research. While this webinar is designed primarily with a county audience in mind, it is also open to the public and our university partners. We know people are joining today with different levels of familiarity with the topic, and our presenter will aim to address the subject matter from a range of perspectives, and we hope that it's both accessible and informative for everyone. Before we get started, just a few Zoom reminders for our audience. Your video and audio are disabled. If you need support from the HUP team or have a question for the presenter, please use the Q&A function, which we will monitor throughout the session and respond to questions at the end. The chat is also open for participants to share comments with one another during the webinar, but please try to direct all questions for the presenter to the Q&A function so that we can make sure that we catch them all. This webinar is being recorded. Please look for an email from hup@umn.edu with a survey and a link to the recorded webinar video tomorrow. And finally, I'm so glad to welcome and introduce our presenter. Dr. Elizabeth Boyle is a professor in the sociology department at the University of Minnesota. Her research addresses questions of how gender relations, national laws, and international treaty obligations influence the health and rights of women and children, particularly in low-resource countries. Much of her work on women and children's health deploys data from multiple nationally representative demographic surveys across time and countries. And now I will turn it over to Dr. Boyle for the presentation.
Great, thank you. Thank you so much for having me here. I'm very interested in talking about data, and I think this is something that affects us all. So while my expertise is really with international data, I'm going to also be talking about the implications nationally and for the state of Minnesota as well. So I want to start with a story. The first week of February last year, I got a phone call from Sunita Kishore. She's the head of the Demographic and Health Survey Program. This is a program that's been around since the late 1990s, 1980s actually, and it's responsible for working with low-income countries to create and administer surveys of women and children's health and analyze the resulting data. And the program had accumulated more than 40 years of data, hundreds of surveys from at least 100 countries, and had facilitated thousands of studies. And I'll give you some other examples of how that data is important later on in the talk. The DHS program was run by a group of about 40 highly skilled and dedicated staff and funded through a contract with U.S. Agency for International Development. So Sunita was calling me to tell me that USAID had been dismantled and that everyone at the DHS program had been laid off. And she didn't know what was going to happen to the data. She was calling me because she knew that my team, the team I work with, were the only other people authorized to distribute the data. So, skipping ahead, past lots of stress and sleepless nights and innumerable meetings and conversations, I'll say that although the program is never coming back in its original form, that because people appreciated its value, including national statistical offices around the world, demographic NGOs like the Population Council, and funders like the Gates Foundation, that something like the DHS program is going to survive. Some things are definitely going to be inferior to the old system, but some things might be better. And so that's one of the through themes of my talk today, is that it's important that we push back and share with people why we think data is so important, and also that creative cooperation among knowledgeable people matter a lot, regardless of what data you're interested in trying to say. All right, so let's just frame. Okay, so without data, you're just another person with an opinion. I think probably most of you are sympathetic to the idea that data is important, and I'm going to be talking about that. Okay, so the overview for the talk today, I'm going to be talking about um, threats to data, and this is definitely a constantly changing environment, and so you may be aware of things that I'm not aware of. Things disappear, sometimes things come back, sometimes new things disappear, and we don't know about it for a while. So I'll be interested in the Q&A to hear about data sets that you've seen changed or threatened. Then I want to talk about the implications and impact of losing data. And then more briefly, I'm going to talk about the responses that people have been involved in and opportunities, because whenever you have incredible upheaval, while mostly you have negative consequences, there's always an opportunity for rethinking things and perhaps coming up in some ways with some improvements. Okay, so talking about how data are threatened, um, I'm going to talk about the ways in which data are currently under threat in the current political environment. And I'm going to talk about some targeted information that's disappearing from data sets. And then I'm going to give you some specific data set examples. Okay. So the ways in which data are being threatened um, involve first disappearing data, then alteration of data, and then more in the background is the staffing cuts to experts, which are leading to, um, which are threatening to data quality and data collection. All right, so last February, as you know, thousands of US government web pages just disappeared from the internet. And we weren't sure what was going to happen, whether those were going to come back. And along with disappearing websites, we also saw a loss of data sets. Um, so eventually, some of these data sets reappeared in a different form. For other data, the old data were posted, but there'd be no future data collection. And that includes things like the demographic and health surveys, which I just talked about, and also, for example, most of the climate data from the National Atmospheric and Oceanic um, Administration, NOAA, that was crucial for understanding climate change. And then also the staff cuts led to um, although they're less direct, indirectly, these are also threatening data. So this is a report from NPR from last October during the shutdown when Trump used the shutdown as an opportunity to lay off people at the CDC. And as Huang reports, when the dust settled, around 600 CDC staffers were cut over the weekend. Um, and this is kind of a pattern where you see positions being cut, and then you see lawsuits trying to get people um, to come back um, or say that these layoffs are unfair and illegal. And the courts will sometimes rule in favor, so people aren't fired. Sometimes they're just put on paid leave. Sometimes they're actually able to work. But this has happened apparently 3 times in the Department for Health and Human Services, where there's a number of people who've been laid off and then reinstated 3 times. So even for the people who are still there, given that kind of environment, one wonders how long people are going to stay around. And this is an example from the CDC, but this is happening in many other parts of the government. Folks are very concerned about the loss of expert knowledge. All right, so what kind of information is disappearing? Well, some of it is random, but some of it seems more specific. So, a recent study by Freilich and Kesselhelm in The Lancet. This came out in May, but they were using data. They were reviewing data that had reappeared in March. And they noted data manipulation within the data sets. And in particular, what they were seeing was with respect to gender, um, any variables that were called gender would be changed to be called sex. Any websites that mention gender would be changed to say sex. And some of these were fairly trivial, but others were more problematic and really didn't make sense. And then the other problem is that m most of them were never documented, so people didn't really know how the data had changed. By March, NPR had given more specifics about the way people were disappearing from government websites and also from data sets, saying across the federal government, agencies have been busy scrubbing photographic and written references about women, people of color, and members of the LGBTQ plus community from their websites. Um, so Biden had passed an executive order in 2023, I believe, that required most federal data to include information on race and ethnicity when it was collected, and that certain health data sets should include, and then in 2024, an executive order that said that certain health data sets should include information on non-binary individuals. For example, the Behavioral Risk Assessment Survey, which can track mm, risky behaviors by individuals, including like suicidal ideation, which of course is really important to understand with respect to non-binary individuals who may feel ostracized and um, there's lots of reasons why they may be engaged in risky behavior. Um, so I thought Biden's executive order made sense, but Trump's executive orders reversed this and eliminated all these variables from some data sets. So the KFF, a, um, a nonpartisan health think tank, um, detailed how racial and ethnic data, broken down by other factors such as an individual's age or sex, had disappeared from the CDC's National Center for Health Statistics data query system, and had been removed for a number of health indicators, including infant, neonatal, and postnatal mortality rates, recent substance abuse, and heart disease death rates. Racial and ethnic data were also omitted from the 2024 annual report from the National Survey on Drug Use and Health. And questions on gender and gender identity had been removed from the Behavioral Risk Factor Surveillance Survey, as I mentioned. Um, the Medicare Current Beneficiary Survey, the Health Resources and Services Administration's Uniform Data System. Um, and so you see particular individuals being targeted. There are specific examples then also of data that is under threat. And here I would recommend to folks that you take a look at dataindex.us. This is an organization that's headed, one of the people at its head is Denise Ross, who was the former uh, US chief data analyst. And she and other folks are keeping track of what's happening with the data. And so But if you go to that website, it's interesting. They provide different kind of categories of risk. So the first is historical data availability. And for they particularly, I chose here four surveys that are related to, or four data sets that are related to health. You can see that the Medical Expenditure Panel Survey, which is about insurance and whether how insurance is, how expensive insurance is, how much of people's healthcare costs insurance is paying. That this there's no problem with historical data there. If we go down to the other left-hand side, National Health Interview Survey, no historical data problems there. Medical Current Beneficiary Survey, same. But then for the National Survey of Children's Health, it looks like there's a moderate risk that even the historical data will disappear. Most of these have a high or moderate risk that future data will not be available. And in the case of the National Health Interview Survey, data index is saying the data quality is a very high risk, but fortunately not for the others. And then I think the staffing and funding risk being high for every one of these, which also influences the ability to make policy, is really important. So in addition to these four data sets, I also wanted to mention the Pregnancy Risk Assessment Monitoring System data set, which is considered the gold standard for understanding maternal and infant health. And it's not entirely clear to me that it's been cut, but I believe that it's been completely eliminated. Okay, so now that you know understand something, I've tried to convey to you the ways that data are under threat. Now I want to talk about the implications and impact of these threats. So I think the something we don't often think about, perhaps, but the fact is that people tend not to count if they aren't counted. They don't they don't enter into our consciousness. They're not on the radar if they're not counted. I'm going to give you an example um, about data that's collected by the Demographic and Health Survey program, which I talked about at the beginning of the program. So here's a map from 1977, and it's showing how many individuals died from maternal conditions per 100,000 births. So in other words, the maternal mortality ratio. Well, what's notable about this map is that most countries in the world in 1977 had no data on maternal mortality. So looking at this map, you might think the world has a few problem spots. Mexico and Afghanistan look like they could be doing better. But in general, it looks like, hey, we're doing pretty well on maternal mortality. But now contrast this map with a map from 1988. Okay, so at this point, the Demographic and Health Survey program had been launched, and health professionals were able to see for the first time how hundreds of thousands of individuals were dying unnecessarily from conditions related to childbirth. So data like this prompted all countries in the world to come together to set goals for improving health and related conditions. So not only health, but things like education for women and access to clean water, distribution of mosquito nets. So um, these groups first established the Millennium Development Goals. This happened through the United Nations. And then more recently, these were updated to the Sustainable Development Goals. And the result was measurable progress. So this is the maternal mortality ratio in 2020. And while you can see that things are certainly not ideal, um, in fact, maternal mortality is very unequal across the world. We also know that it's improved a lot over the last 30 years. So if we look at, you can't see it here, but if you look at just global statistics, maternal mortality has dropped by more than half, from more than 430 um, deaths per 100,000 births in the 1980s to only 212 in 2020. Again, that's still way too high, but it's been huge progress. And the other thing about this is that because we're counting now, we also know that around the time of COVID, maternal mortality, infant mortality, and a whole lot of other health indicators took a dip. And of course, things are happening with respect to vaccination and other things right now. And so this isn't the moment to lose sight of what's going on. This isn't the moment to stop studying the trends. This is precisely a moment when we need to be studying these trends to take action in the future. So because of the demographic and health survey data, we knew lots of things. We also know that 2.1 billion people have improved water sanitation since 1990. Child mortality has dropped from 11% globally in the 1980s to 3.7% globally today. And so um, the statistics and the action that went along with these statistics matter. And back to my main point is that people count more when they are actually counted. They're easy to ignore when they're not counted. Okay, so how does this work specifically? Well, data are important for identifying health status and needs, including disparities, um, and directing efforts and resources to address those needs and disparities as they're identified. Um, then you can also assess the impact of policy changes And so this is the tracking. This is why trend data is so important to have continual surveys and not just a single survey. Because all of these things lead to accountability. Countries can't simply ignore, states can't ignore, or at least it's harder to ignore when what's happening when there's data and when things are being tracked. And so it improves accountability. Um, and accountability can be hurt by a lack of reliability in the data and a lack of transparent data. And I'll talk about that more in a moment. But basically, all of these factors are essential for making progress on health goals and also for developing effective policies. And an example of that is the Sustainable Development Goals and the health outcomes that I was just talking about, all of which are identified in these Sustainable Development Goals. Okay. When I say that people count when people are counted, another aspect here is disaggregation, and this goes back to what I was talking about earlier with what kind of data has disappeared or seems to be disappearing. So we need data that can be disaggregated by groups. We need to know what's happening with American Indians. We need to know what's happening with African Americans. We need to know what's happening with immigrants when it comes to health outcomes. And so when we cut these things from data, that becomes a real problem. But aggregation is also important. So one of the things Denise Ross, the person at dataindex.us, who is the former uh, chief data analyst for the US, notes a concerning trend where the CDC's infant maternal mortality data is no longer aggregated to the national level. It only exists in disparate state reports. And that's basically a consequence of 17 staff members being fired. It's not like a conscious policy decision, it's just happening. Okay. So one of the consequences is that people and certain groups of people and people in particular locations don't matter if you don't count them. It's easy for people in power to just sort of say everything's great, it looks wonderful, and if we aren't gathering data, we don't know anything else. Another problem, of course, is poor policy choices. So let me break down this figure for you, which I found really interesting. So this was in the Lancet. It's a study that was done by McAndrew and colleagues in May of 2025, or with data from May of 2025. And what's happening here is we're beginning at the end of the 2023 influenza pandemic or influenza season, and we're predicting hospitalizations through the middle of the 2024 influenza season. So these researchers wanted to show how public health data surveillance enhances public health practice. And to do that, they analyzed data from 7 US government-maintained sources associated with seasonal influenza. They fit 2 models that forecast the number of influenza hospitalizations in the US. So the first, which is the blue dotted line, the blue line with circles, is a data-rich model incorporating data from all 7 of the government sources. And then the second model, and I should mention all of the 7 data sources that they use were under a threat of disappearing or being altered. The second model was a data poor model that was built using a single government data source, which is about hospitalizations. So here's what you're seeing in this table. So we begin at the end of 2023. And the yellow line, as I said, is the data poor model. The blue line is the data rich model. And the black line, which wasn't actually part of their modeling, but they're putting it up here to show accuracy because this is historical data, so we know actually what did happen. Is the solid black line is what actually happened. And so you can see that the blue line is a lot closer to what actually happened than the yellow line. The yellow line was drastically underestimating how much influenza there would be. Another thing that's interesting about this table is the confidence interval. So the gray hump that you see there, that is the confident 95% confidence interval around the blue line. In other words, that's the level of certainty. We're certain that we're in with this range. And you can see that in the case of around week 50, where there's that spike in hospitalizations, that it's still inside that confidence interval. For the yellow line, part of the fact that there's only one data source means that the uncertainty level is enormous. And so literally it's off the charts. It's that yellow shadow in the background. And that's why they have this little inset on the top right that shows you just how far up the lack of confidence goes. So essentially, while we were making predictions that were way too low in the basic numbers, they were pretty much so uncertain that they were worthless to begin with. Okay, so that's a second way, obviously, in which losing data is problematic. If you lose data, you don't have good information. The third thing, which I think is a particular issue right now, is a lack of transparency and trust. So people need to trust the data that they're seeing. So let's go back in history for a moment. This is actually a really old. You can see this starts in 1961 and goes up to 1985. And what are you looking at? Well, you're looking at the gross national product of the Soviet Union, and the top numbers that include what the CIA thought was the Soviet Union's um, economic growth in each of those periods. But then below that, in each of these lines, you have the Soviets. And then also so the first one is output and the second one is industry. But the basic takeaway here is that the Soviet measures were way, way higher than the CIA measures. And that's because the Soviets were making up a lot of the data. When you can't trust the data, um, then uh, nobody's going to believe government statistics. Um, Also, when it comes to trust and transparency, I want to talk a little bit about the food insecurity data that's under threat right now. So the Trump administration has terminated the food security survey supplement to the current population survey, saying that it is redundant. And these data are the nation's single longest running and most consistent measure of key indicators of maternal hardship or families' abilities to meet basic needs. No other federal survey is nationally representative, also representative at the state level. Nothing provides this level of detail. And this is data that's been used for decades by both parties um, to inform policy decisions. And while the government currently is planning to eliminate this really great supplement, they're also removing some of these things that they say are redundant. And so even if you believe that this was redundant, it seems like the food insecurity data is just disappearing. So for example, they're removing the single question related to this that's with the National Health Interview Survey. And it also appears that the National Health and Nutrition Examination Survey, which is obviously relevant because it's about nutrition, is under threat due to funding cuts with respect to staff. So it seems like there's political timing here because the big beautiful bill cut food assistance, and now we're not going to have good information on how that affected people. And it also seems like federal funding for SNAP benefits, well, federal funding for SNAP benefits was cut during the government shutdown, and now we're also not going to know the impact of that. So, whether this is actually political or not, in some ways is less important than the fact that people feel that it's political. And so people, again, are going to not trust the government. They're not going to trust the data that they can see. And so we're not going to know how these policy changes affected families, children and families. Another thing I think that is threatening to um, trust and transparency related to data right now is the Trump administration firing of the head statistician at the Bureau of Labor Statistics. because that person had um, updated the data, updated employment data, and that update was not as positive as the previous months had been. And so Trump just fired the person. And basically, this looks like demanding loyalty over ethics, over taking a professional approach. And so again, I think it weakens trust in data, weakens trust in government. All right. So how is this impacting states? Well, obviously, health data has a lot of federal health data is really important for states. Um, States use federal health data for disease surveillance and response. This would be like the influenza data that I just showed you. They use it for policy development, to know how to allocate resources, like for example, where are rural areas suffering, who in urban area needs more attention. They also use this data to respond to health emergencies. And of course, historically, there's been federal partnerships for helping states to fund programs. So, for example, a number of states, including Minnesota, have the pregnancy risk assessment monitoring survey. But and again, I'm not sure exactly what's happening because these things are often opaque and it's hard to know, but it seems like that funding could be under threat. Now, with respect to Minnesota, you probably read this week that there was a pause because of a court case in the $600 million federal cut to food programs in Minnesota. But that is obviously a huge concern. There's been cuts to COVID response funds. There's been changes in vaccination policies that could be a threat, could reduce vaccinations by parents in Minnesota, even though Minnesota is maintaining the old standards. And um, even if Minnesota can keep up its vaccinations, because other states' vaccination rates are getting lower and lower, we have this problem with herd immunity. So data concerns are one more worry, and I do uh, feel that with everything that Minnesota is experiencing right now, that it's possible that these could fall off the radar. And I hope that's not the case. I completely agree that we have uh, so many things to worry about right now, but I hope people will keep this one additional ball in the air. Okay. So now let's talk a little bit about responses to data threats. Um, so first, some folks propose alternative sources of information, and this is kind of a cool idea. So let me just tell you a little bit about those. I don't have a slide, but I can talk about two different things that people are talking about. So one alternate, well, of course, there's actually three. So one is to just look at other sources of information, which tend to be more like not nationally representative surveys or more limited studies, and trying to put all those studies together. And that's better than no information at all, but that's not certainly not ideal. Um, Another alternative, of course, because of its popularity right now, is to just use artificial data. So um, feed some information into artificial intelligence and then it will pop out data for you. And I've seen this happen um, with respect to things like climate change. So people, a lot of times, hard scientists who are really focused on the technical details of climate change will simply use AI to assess what will happen to human populations as a result of climate change. And at the big macro level, that's actually super interesting and that's great. And I understand why those people are focused on the big picture. But when you get down to Hennepin County, those big models are pretty much worthless because you don't know how individuals in Minnesota or in Hennepin County are going to respond to specific climate change threats. And so without actually going out and talking to people, without surveying people, um, the assumptions that are made in those AI models could be completely wrong. So that's not a great alternative. Another alternative that folks use is sometimes you could call it crowdsourcing, or you could call it um, big data, and it's taking things like reports of, um, well, like things people are doing on their phones, or uh, like things that people are reporting on social media or things like that. Again, these have their place. Um, they can be useful for understanding trends and things that are going on and what some people think are important. But at the end of the day, that's not at all representative of individuals. So if you're using it to like look at instances, so there are these websites internationally that track violent armed conflict, and they use crowdsourcing as sort of an original source. And it's useful because then they can go back and they can go to each of these sites and they can talk to people and find out, oh, did violence actually happen here? And calibrate their data. So they get initial reports, and then those tend to change to become more accurate reports. But that's about events and activities. When you're talking about individuals, there's so many people who aren't on social media, and that's going to be correlated with access to resources and things like that. And then in addition to being non-representative, the big data tends to be really, really thin. So you may know what people are posting, but you don't have any real data about the people who are posting certain things. The other thing I wanted to talk, so I don't think that alternative sources of information are really going to be that valuable. Um, Another response that I think is more promising is activist expert responses to the deterioration of data. Um, so we have experts who are insisting that the federal government use a evidence-based approach. I just saw Michael Osterholm on uh, the PBS NewsHour on Tuesday, talking about this recent case where some vaccine was not approved by the CDC in an unprecedented way. And he was like, no, this isn't looking at the evidence. This isn't okay. And I read today that the CDC is backed down and is going to let Moderna, um, you know, is going to continue its studies and find out if this works. We also have people, as I mentioned already, I've mentioned a couple times Denise Ross, who was the chief data scientist for the federal government. She's really taking action. And as I mentioned at the beginning, like with the demographic and health surveys, a lot of national statistical organizations with support from the Gates Foundation and their own tax dollars want to continue the something like the demographic and health surveys. And so there's actually kind of a positive side to this where there's going to be more local control and more specific questions that are relevant to the local people. The problem, of course, is that then that it's going to be harder to aggregate, and those kinds of maternal mortality statistics that I showed you at the beginning may be harder to come by. Okay. So in terms of taking action, I also wanted to mention to you that there's a survey that's being conducted by the Social Science Research Services at the University of Wisconsin-Madison, and it's looking at the impact on data users of changes in the federal statistical system or survey system. So I'm going to see if I can get Margaret to put that in the chat in a moment when we're at questions. And then you can link to the survey. And it is time sensitive. It closes February 27th. Okay. Finally, I want to talk about opportunities just in a basic sense. So whenever there's upheaval, um, it it can create a lot of problems. But forcing people to rethink their assumptions, forcing people to assess, have we really been doing this the best way, or have we just been doing this in this particular way because that's what we've always done? It's always good, I think, to have moments of breakage that force us to reflect on our assumptions and why we're doing things a particular way. So there may be an opportunity here to reimagine topics and questions. Um, and new ways of reaching people with survey data and other kinds of health data. And as I said before, as is happening with the demographic and health surveys, one of the silver linings might be more of a local connection where states are doing more of their own data collection. It's unfortunate and sad that we may not be able to compare that data with other states as we did before, but that might also be a direction that we end up heading, depending on just how bad this gets. Okay, so in conclusion, there are some real threats to data right now, although they are hard to track because things disappear and then they reappear or they're altered, but there's no record of them being altered. And then just the degree to which things are changing is not being documented. So it's like these periodic reviews where people are like, wait, this data's gone, are kind of what we're relying on. Um, I also want to, I also talked about how the deterioration in the data environment has really important implications. It tends to reinforce inequalities because the people who aren't counted tend to be the people who are often the worst off. Um, you can't track trends or make effective predictions, and that's bad for policymaking. And then a lack of transparency, just like we don't understand what's happening with this data, or this data has been changed and we don't know how, can lead to a lack of trust in data. Um, and so there are some real problems with the current situation. There are some alternatives to the nationally representative high quality surveys that we currently have, but those alternatives are limited and um, uh, have some real limitations. Pushing back has been somewhat effective, and again, I encourage everyone to try to do that. Another thing that you can do is you can keep track of the Federal Register where they post when data is going to disappear. So if it's data that you're using and you see that it's threatened, definitely do put in a public comment there. But finally, a time of upheaval provides opportunities for rethinking and positive change. And so there is a little bit of a silver lining here. All right, thank you very much. And I am interested in discussing this with you.
Yeah, Dr. Boyle, thank you so much. If you have a link to the survey, I would gladly put that in the chat, and we can also share it after. We can share it in our follow-up email so that folks, whether they're here today or not, can have a chance to respond.
Great, thank you.
The Q&A is open, so for our guests, I would welcome any questions that you have being put in the chat or being put in the Q&A rather. I also know we have a lot of practitioners on the call, so if you don't have a question but want to just comment on how the climate has affected your work, feel free to put that in the chat as well. I'm curious, how all of your work has been affected. And it looks like Dr. Boyle has put the survey in the chat, and I'll grab that to put in our follow-up materials as well. Yes, one thing that I was probably the most curious about as you were talking, having not tracked this issue as closely, obviously, um, I was it felt optimistic to hear about the some of the success from some pushback. You referenced one particular case, and I think you referenced an individual. Curious if there are like coalitions being built around pushing back on data, or if it's generally handled at an individual level, or what you've seen.
Yeah, that's a good question. I think that there are people who are stakeholders in particular data sets, and so they're mobilizing. But then another thing that's happening is a broader kind of pushback. And yeah, I'm trying to think of, I mean, I do feel like if you Google Denise Ross and her first name is spelled Denice. Um, she has lots of good suggestions for how people can push back.
Thank you.
Mhm.
Um, and I see a question has come in through the chat, perhaps related. What work is being done in Congress to push back on disappearing data?
Yeah, that's a really good question too. I I feel like our so I think currently we don't have a lot of pushback from Republican members of Congress. They're pretty much okay letting this go, but that could change if they start to see things that are really affecting like maternal health and stuff. You see, and there's a lot of people who are concerned, for example, like about the pregnancy risk assessment monitoring survey and what's going to happen with that. And I think that that probably crosses political lines and that everybody wants mothers to be healthy and wants to promote healthy families. Um, so some issues cross the divide. I do feel like perhaps on the Democratic side that people have so many other concerns. Like for example, when USAID was shut down, there was hardly any information about the Demographic and Health Survey program because I mean you're cutting programs where that provide directly provide services, and so those things always get first billing. I kind of talked about that with respect to Minnesota too. And of course, they should get first billing, but I don't think we should lose sight of these really important foundational data issues while we're pushing. I mean, they are very much related to our effective ability to promote health.
Thank you. Another question, uh, with all of these layoffs, are you hearing people volunteering their support to help with data gathering?
Um, not so much because it's really hard to, as an individual, do your own data collection in a way that's significant and certainly like nationally or even locally representative. It takes a lot of resources to, I mean, in relative terms, right? Um, compared to cutting 600 million from food supplement programs, this is a drop in the bucket. But it's not the kind of money that an individual can come up with, and also just like maybe putting a survey together and doing the data analysis and things like that, it kind of takes someone who knows the statistical sampling stuff, knows how to, someone else who knows how to like write the survey, a statistician who knows how to analyze the data, and then somebody who knows how to make an effective report that actually communicates the data well. And so it's hard for individuals to do this if they're not associated with an organization. That's one of the reasons why it's so important to keep this in the government.
Sense. Do you foresee state level research and data collection growing in the absence of federal registry work? For example, growing numbers of state-led consortiums.
Yes, I think that probably is going to happen. Unfortunately, it probably won't be completely national then. There'll be some states that just don't participate, and that's really unfortunate. But yeah, in general, I think, and I'd be curious what other people in the audience think, but I think that the states are going to begin to take on more of the responsibilities that the federal government has taken on for, the last 100 years or so.
One more question I see, or maybe a couple more. We're seeing data disappear and data get altered, but we're also seeing this administration blatantly ignoring, disregarding, and misrepresenting data or outright lying. Can you speak a bit more about that and what we should be aware of or and actions we can take to push back or hold people accountable?
Yeah, another good point. Well, that is a huge issue, and um, I think they're really kind of two separate things. So, right, this isn't an evidence-based policy making administration. It's more policy making based on um, personal opinion or um, the moment of the day. Uh, and so that's problematic. And I think, again, I think Republicans and Democrats can both push back against this lack of evidence-based policymaking. It's it's so incredibly harmful to so many people. And you may think it doesn't affect me, but in the end, everybody is going to be affected by this poor policymaking. Um, I think that the data issue itself is somewhat different in that it's sort of looking forward and saying if we dismantle these programs now and we destroy the institutional memory that's created these long streams of data, that what comes, it's going to take a long, long time to rebuild that. Um, and so it's kind of looking beyond Trump to what I hope is a moment when we go back to evidence-based policymaking.
Yeah, thank you. Um, with budgets getting cut, are agencies being forced to pick priorities in data gathering? And just a comment that that's very challenging if that is the case.
Yeah, yes, absolutely. And then, so if you're doing a survey, but like the person who um, let's just say right surveys is gone. So then, how do you move forward without that particular expert who was, doing that particular piece? And right, figuring out how you can do surveys more cheaply, um, which, yeah. Sometimes people can come up with some brilliant ideas, some real ingenious things. Other times, you can just it's just a question of the quality and you start to lose quality. Like, for example, if you can't have a representative sample because you can't afford to talk to that many people.
Mhm. And another question, the survey speaks to statistical agencies at the Fed. Is there something similar for public health oversight systems, thinking CMS and other HHS agencies like NIH?
Yeah, okay. I didn't talk about NIH, which has also had its funding cut, which is a whole, it's not exactly um, government data because it's um, often created by researchers. I mean, I'm funded by the National Institutes of Health, and my research is all about making data comparable. So I take the demographic and health surveys over the last 40 years and make sure that other researchers can compare those and also compare them to similar surveys that are coming out of the other big sources. The United Nations does these multiple indicator cluster surveys. Um, so yeah, there's still that. Uh, well, okay, so NIH is also under threat. They were cut in the big, beautiful bill. Um, my own experience is similar to what I talked about today, where certain words like climate change can't appear in your proposal or it won't get funded. It's a weird thing. Um, so I would say things are happening at NIH, things are happening, and I'm not so familiar with all the organizations in the Health and Human Services Department. But I think all places are being affected, but in somewhat different ways. Um, and all of it is leading to poorer quality data.
Are you personally seeing evidence of a US brain drain where researchers are leaving the US for countries that are friendlier to their work?
Hmm. I have not seen that so much myself personally. I have read about that. Um, What I have seen are some individuals who are older, who were, real experts in their field and had lots of institutional memory, retiring early
Mhm.
because they just don't want to deal with it. So it's a different kind of thing.
Yeah, thank you. Well, I want to thank our audience because there were a lot of good questions today. Certainly, if another one pops up in the next moment or so, I will address it. But I really want to thank you, Dr. Boyle. Thanks for sharing your time and research with us, and to our audience for joining us. I am going to put our feedback form in the chat, and I put the survey in the chat as well. Looks like we're getting some thank yous. So yeah, Hup would love to know more about our audience's experience. We have the link in the chat. And Dr. Boyle, again, thank you so much for your time. The recording will be available tomorrow. Thank you so much.
Great. Okay. Thanks, everyone. Feel free to reach out to me if you have more questions. Thanks very much.
Thank you. Have
Bye-bye.
a good rest of your day.